right, moving on to our next speaker, who is going to talk to us about the Beatrice W. Welters Breast Health Outreach and Navigation Program. And I would like to welcome Anita McFarlane, who is the program manager for the program, and she's going to talk to us about what they do. They do a lot of great outreach efforts, so let's welcome Anita.
Good afternoon, everyone. So I want to talk to you about the Beatrice Welters Breast Health Outreach and Navigation Program. And for those of you who were with us last year, you might remember my talking about our beginnings of our program, where we were going, and today I'm going to talk about where we've been, and to also thank some of you. Some of you invited us to your churches, to your sorority meetings, so we just want to say thanks and keep those requests coming. If you remember, Mrs. Welters is a woman of color. She was diagnosed with breast cancer some years ago, and she was treated here at NYU, and she decided that she wanted to give back. And so she gave back to the institution a donation to create our program. And essentially what the program does is it outreaches to communities of color. It educates those individuals about the importance of breast health, about getting mammograms, about being good to yourself. And then for those individuals who are interested in getting screened, we enroll them into our navigation program. So outreach, education, and navigation. The Welters Team. So when I was here last year, it was me and 2 navigators. We have expanded. We have picked up additional funding for another program, and we have added a number of staff. So all those folks who greeted you this morning, they are on the Welters Team. So we have a host of navigators. Margaret is our case manager, who you heard speaking to you about support programs. And then, of course, our co-directors, Dr. Joseph and Dr. Ravenel, who, if you were here again last year, spoke to us about disparities in cancer. So we have a very large team who goes out to communities throughout the 5 boroughs and educates, navigates, and provides outreach services. Where do we go? So I think when we were here last year, we talked to you about the importance of our work focused on Brooklyn. If you remember Mrs. Welters' story, she grew up in Brooklyn, and she wanted to make sure that we offered the services that we provide to people in Brooklyn. Why? We know that the breast cancer rate's fairly high among people of color. We know that in Brooklyn there are large numbers of people of color who live in Brooklyn. And so a lot of our efforts were focused in Brooklyn, but we also realized that we need to go everywhere, and so we cover the 5 boroughs. So not only do we focus our efforts in Brooklyn, we're also in Harlem, Queens, Staten Island, even Staten Island, and the Bronx. What's a typical day for a navigator? There isn't a typical day. So this is what they do. They go out and they do some tabling, they do some education. You may recognize these ladies. They're sitting out front. This is Karen and Patricia. They take our wares and they go wherever they need to go to provide education. And then Neftali, who you saw out front, also provides education. He spoke at Woodhull not too long ago. And so again, we talk about the importance of breast health, about getting a mammogram, about anything that you needed to know about the importance of screening. And that navigation piece, the navigation piece I think is the most important component of our program, and why? We all know that when people come to us, and if they're diagnosed with breast cancer, it doesn't mean that the rest of their life stopped. It doesn't mean that they still don't need to take care of their kids. It doesn't mean that they still don't need to go to work. It means that they not only have to deal with the diagnosis of cancer, now they also have to deal with the rest of their life. And so the navigators just jump in there and they take a person's hand from one place to the next. So we do outreach, we educate, and if you are screened through our navigation program and you're found to have an abnormal finding, we help you through that diagnostic sequence. If you're found to be diagnosed, we help you through treatment. We provide with wig assistance, with prosthesis, with transportation, any and everything. People come to us with issues around their visa, housing issues. They don't have food to feed their families. Our navigators are there at every step. And at every step, we are helping people complete their treatment and move into a quality of life. How do we reach the populations that we reach? Through outreach. You know, again, I want to say thank you for those of you who invited us to your churches. We're still going to churches. We go to beauty salons. We go to nail salons. We go wherever we are invited, and we also reach out to organizations to say, can we come speak to your congregation? Can we come speak to your constituents? Can we come speak to the people who use your laundromat? So how have we done this year? So last year we had 3 navigators. I think maybe we had 3 or 4 programs. Well, we've rocked this year. We have reached 3,976 people. We've gone to 83 events, and we have covered the 5 boroughs. So we've really gotten out there, and we're going to continue to do this work on behalf of Mrs. Welters. So just in closing, what's the importance of this work? Why is this all about? Because we want to talk about the importance of being good to yourself. You know, a lot of you are here, and you're here because you're interested in the information. You want to take this information back, but there's a whole lot of empty seats here. So there are a lot of people who, for whatever reason, don't want to come out for this information. So we go to you, and we want to take that information to the communities that we serve. How do we do that? Through navigation, through taking people by the hand, walking them step by step through that process. We know you're scared, we know you're frightened, we know you got stuff going on. We help you all the way through that process. We help you provide support, help you in providing support and access to quality care. When we navigate, we don't force you to come to NYU, we don't force you to come to Bellevue. We will navigate you wherever you want to go. Okay, you work 6 days a week, you're only off on Sundays, and that's the only time you can get a mammogram. We'll find a facility that will give you a mammogram on a Sunday. So we work with wherever you are and whatever situation you're in. And then we help you through treatment, all the way ushering you through to survivorship. So what's important about this program, Mrs. Welters wanted to give back, and she knew if she gave back, she would empower people, she would empower women with information, with assistance, with support. Why? Because she wanted our clients to live their life, to enjoy their families, and to continue their lives just as she has. Thank you very much. Oh, one other thing. We're going to be at Circle of Sisters. How many people know what Circle of Sisters is? Yeah, okay. Circle of Sisters is an expo. It's all about women of color. You can come and learn about wellness. You can come and learn about spirituality, about small business. It's going to be at Jacob Javits Center on September 30th. We're going to be there from 10 a.m. to 10 p.m. Dr. Joseph is going to speak. We conned her into coming. So we're going to be there giving out our wares. We'll have prizes. We'll have games. So please come see us at Circle of Sisters. If you want more information about us, here's my information. And as Margaret mentioned earlier, we have an email address, so you can email us and we'll respond to you. And we also have an 800 number, 844-90-BE-WELL. Thanks so much.